Thank you, Jen, and also to my colleague, Tricia, who just joined us, and also to all of our listeners. And we really appreciate the opportunity to, share with you what we've done, with the latest edition. And so, as you can see, both Tricia and I are here, and also our colleague, Dr. James Harris, couldn't be with us today. He also is as an author and has contributed to the eighth edition. And and again, we appreciate his work as well. So, what we'd like to do for the first part of this is to really talk about some of the, what we've done in terms of looking at trends and patterns in leadership and healthcare administration. And so, as you can see on our slide for future trends in leadership development, um, we continue to see, and I know you have as well if you've used the book and you work with nurse managers, executive students in nursing administration, clinical nurse leaders, maybe DNP students, that our environments continue to be complex and difficult to manage. And so we are really seeing relevant shifts in the expanding of boundaries within our healthcare system and non-traditional, again, as population health is being really key to some of the major, again, trends. And so we're seeing in these complex systems large interacting elements, information that continues to be very ambiguous, incomplete, and indecipherable. In fact, from an information and a technology perspective, we know that digital data accessibility has really reached a tipping point due to the combination of our multi-generations environment, technology, and governmental factors. And we know that individuals are now able to access clinical data via their smartphones. Even Medicare recipients are downloading their history from Blue Button 2.0. And our millennials and our Gen X population, they bring really a very fundamentally different set of expectations because they're used to accessing data. And so healthcare systems and payers, lab services, and other providers really are beginning to offer a lot more ways for individuals to access and use their data with fewer restrictions. And the interaction among these systems that are nonlinear, tightly coupled, these small changes can, truly produce disproportionately large effects. So as we, again, continue to look at the trends, and again with complex systems, we're seeing that solutions are ways that we are addressing some of the issues that we're having with our complex systems, is that they're really emerging from outside of the system, and our results, because of the complexity, are not always predictable, and so as we control and centralize, sometimes we have greater that extends our opportunity to make rapid decisions. And hindsight, doesn't always lead to farsight, since again these conditions, these elements, all these interacting variables of the system are continually in flux. So again, as we talked about challenges for future leaders with the information overload, again the interconnectedness of systems and the business community, and also from again the boundaries that are expanding. If, for example, in their annual meeting of healthcare prediction for the 2020, Forbes thinks that AI, artificial intelligence, and healthcare IT will exceed $1.7 billion, with breakthroughs in medical imaging, analysis, pharmaceutical development, and risk reduction. Also, the Cleveland Clinic has put AI in its list of top 10 medical innovations for 2019. And then Harvard Business Review also has highlighted that. In a study done in 2017 in the Spine Journal, AI was highlighted as the assistance during robotic surgery, reduced complication by a factor of 5. And again, Harvard Business Review analysis showed a potential 21% reduction in length of stay for orthopedic patients. So again, informatics, technology, AI, truly has again expanded these boundaries. Trish, next slide.
So as Linda mentioned, we're seeing a lot of new technologies really disrupt our old work practices. And not only is it disrupting them, it's making them both obsolete but also cumbersome. And so as we really look at the generational differences and a multi-generational workforce, we have both the strengths of each generation and new expectations. So as Linda mentioned, just as our patients and our recipients of care, as well as leaders and followers come together in this new space, the technology is really going to be the thing that creates the incentive or the impetus for us to look at leadership in a different way. And we are recognizing that there's more globalization, both in terms of industry, but equally around healthcare and innovations and ways to bring people that were once very far away right into our backyard. And that means that we need to learn how to manage across different cultural diversity. So the technology is both disruptive, but also a space that we need to embrace, because it becomes then a lever for us to be even more effective in the work that we're doing. When we really think about the skill sets that are going to be needed for nurse managers and administrators, but I would say more broadly, nurse leaders, our ability to adapt and to do so with grace and poise, recognizing that we are making adjustment, coming really from a place of self-awareness, who we are, how we show up in our work, what our strengths and our gifts are, as well as where we may have rooms to grow. But I think the most significant skill set is really understanding that we're going to have boundary spanning leadership. We will no longer be leading in a single setting or a single unit, but really beginning to lead across boundaries. And it's going to extend beyond healthcare delivery to really become a part of the community as we engage in population health. So while we have become very accustomed to really leading in a sphere of health practitioners or health providers across disciplines, what we're really finding is those boundaries are expanding well into the community, across industry and across practice settings. And that it will mean that our leadership abilities also need to expand and change. It's really going to be this collaboration that helps us all to find a space around health and wellness in the country, but across practice boundaries, that allows nurses to step into their rightful space as leaders of multidisciplinary and interprofessional teams across practice settings. But it's that network thinking that is certainly something we've been doing as we've talked about matrix organizations, but it's really extending that well beyond what our boundaries have been historically into new ways of thinking, how we can contribute to a network of thinking around population health and leadership. So on the next slide, we really wanted to talk about some of the attributes that will be important for future leaders, and they really center on our ability to be flexible and to be agile. So while we think that we are moving at a rapid pace now, as technology enters the landscape, our ability to be both quick responders but thoughtful responders and agile in our ability to incorporate, or for that matter, to let go of elements of our history, elements of our technology, old practice patterns that no longer serve us well, old leadership thinking around who knows best, and really elevating all of our individuals to lead in the space that they're practicing in. But going global will be another important part of this. And while we believe there's much to share in the United States, there's also much to learn. And I think future leaders will be required to have an even wider global network and global perspective to bring back those attributes of leadership and healthcare provision and measurement outcome management that we see in many of our global colleagues. But there will be a greater demand for the ability to document core competencies, not as tasks that have been completed, but truly competencies and skill sets that can be transferred into different situations and into different practice settings. So implementation science and sustainability are becoming those key levers to help us appreciate that having the right evidence, having the right information or research is really not sufficient to ensure that when it is implemented, it will be effective. And likewise, the fidelity of that implementation, the consistency of the implementation, not picking and choosing those steps that appeal to our culture, will really be key to sustainability of practice improvement. So it's going to require a new kind of collective leadership, a way of bringing forward the talents and skills of many individuals across disciplines and across practice sectors for us to be able to collectively lead and bring organizations to success.
And as we think about our future leaders and their attributes to not only manage but lead in these complex systems with greater diversity, expanding boundaries, that creativity, really being able to look at problems that continue to emerge, but also some of our same problems that we just seem to not be able to really get a handle on. So these wicked problems. So thinking strategically, again, managing change effectively, really understanding all the nuances around how we change and how we think systematically, and being comfortable with ambiguity. So it's not the either or. Either we provide quality care, or we are cost effective. It's and both. And so really being able to not only work or deal with ambiguity or just live with ambiguity, but to really embrace it as alternatives to and non-traditional ways of thinking about the work that we do. We're the wicked problem and problems that, again, because there's really no ready solution. Again, we talked about non-traditional, non-linear, integrative thinking, and then, thinking about our thinking in ways to, again, better, look at this from a wider perspective, but also taking into account the microsystems and, where work really happens and how we, we lead and we manage in that work. As we, consider leadership development and management, I'm the future trends in leadership development. The Center for Creative Leadership, which comes out of Harvard, really offers some, really good work in terms of some of the work they've done around interviewing leaders and managers in healthcare, not just healthcare systems, but in health in systems, business, industry, that we're shifting away from one-way hierarchical organization-centric communication, again, toward two-way or more multi-level network-centric participatory and, as Tricia shared, collaborative leadership styles. So as we began to really put together our thoughts and looking at trends and looking at research evidence for our 8th edition, we continued with the leadership development and again looking at organizations. And as the Center of Creative Leadership shared, that organizations have grown skilled at developing individual leader competencies, but really have not been as sensitive to the challenges of transforming leaders to greater collaboration and also collective leadership. So today's horizontal development within a mindset must give way to the vertical development of bigger minds, and again, new ways of thinking. So in our newest edition, and we have reviewed all of the chapters and have expanded, again, updated. But we wanted to really share with you some of the chapters that and that we've had greater emphasis, if you will, as well as new chapters. So, Tricia?
Thanks, Linda. So I think that one of the things that we recognized as we spent time in the literature and talked to executives in their roles the things that they really emphasized to us centered on an understanding that coaching is really a lever for professional development and leadership development. And while many of us consider coaching a tool around how to improve someone's performance, what we've come to appreciate is executive coaching really is a lever to help people who are already effective be more highly effective, and to help our emerging leaders grow more rapidly. So it really is a focus on systems thinking and emotional intelligence, that self-awareness, and relying on our own inner wisdom and knowledge to create and generate solutions and new experiences for our growth. And it really centers on building a resilience in our nurse leaders, not because they have a performance issue or they have problems, but recognizing that creativity and our ability to lead is enhanced when we are resilient. And so when you think about principles of high reliability, and you really think about creating cultures of safety, one really significant element in that is our ability to build resilience in others. So as nurse executives and nurse leaders, it's important for us to have tools to actually build that resilience in ourselves first. And so coaching really becomes a way to learn and to emphasize for people that they often have solutions to their own problems. It's a matter of reframing the existing circumstance so that they're not becoming bogged down in either past practice and habit or the culture. So there have been some really interesting studies on the return on investment that coaching has in building and growing leaders, and in helping high performers become even higher performers within an organization. So it rests on both the ability to retain talent, but equally the ability to grow and build talent internally that can expand their own impact on an organization. So while we've called forward Chapter 4 as really the focal point for the new information around executive coaching, I would just like to say that it really walks hand in hand with the chapters on maximizing human capital, and our ability to recognize that it actually is our human capital that becomes our greatest asset, and our ability to actually coach and to grow and to groom our human capital with very specific tools, not in performance management as we've often thought about coaching, but rather in growing and developing leaders. Executive coaching then can be a vehicle for that work. Another area that we spent a fair amount of time talking about is really the uncertainty and developing nurse leaders when there is less predictability in our world. So many of us had anticipated that there would be wide and far-reaching change in 2010 when we actually had healthcare reform law passed, and yet what we're beginning to really appreciate now is that it is an emerging change, and there's while there is some certainty, there's equal parts of uncertainty, and in some ways greater uncertainty because of the way this model has emerged. The changes and shifts in reimbursement, historically acute care focused and really being driven by volume rather than value, now being shifted into an era of values-based purchasing, and the recognition that it's not episodic care that will drive our reimbursement structures, has created really a new kind of complexity. So while we're actually standing with a foot in two canoes, it's very difficult but important for us to be able to navigate the landscape. And it's the complexity science and calling forward that even in the most turbulent situations, there are patterns that can be deciphered, and that there are actual ways for us to move through the complexity to be able to be effective in our leadership. So communication and relationship building is key. And as I said earlier, it really does center not on necessarily our traditional patterns of relationships and interactions, but extending well into the community around advocacy and policy work, but also partnering with people in the industry outside of healthcare to help us with innovation and bringing those innovations into the practice realm to improve patient care outcomes, and then our ability to care for them. So our professionalism and professional development roles for future leaders really is shifting and expanding well beyond what we had done historically. It embraces all the elements around simulation and competency development, but it also has to do with leading individuals that may not be nurses, may not be members of a clinical team, and recognizing that that will be the challenge that we face as we walk into different ways of thinking about leading and leading healthcare. We wanted to talk a little bit about strategic planning and the practices of really achieving organizational excellence. So while we're all very well versed, I think, in the elements around budgeting and planning fiscally, there's also a lot of important information that we've brought into this textbook about organizational learning and the role of the nurse leader in helping individuals in the organization come together to learn as an organization. So while historically we've spent a great deal of time on individual learning, we've brought into this latest edition several ways of looking at organizational learning to promote success and effectiveness. So it certainly involves the environmental scanning that we're accustomed to in any strategic plan, but it also calls forward the need for us to actually take on a different lens around business plans and scorecards that extend beyond our traditional boundaries, be it acute care, long-term care, or community-based care, to recognize that there actually is an interaction among and between all of those places where health, wellness, and healthcare can be provided. So our new edition has really called forward change leadership. So not just managing change or how to bring change into an organization in a disciplined manner, but really how to be a change leader and to bring innovation and resilience around those practice changes to help us be more effective in being a leader of change rather than a manager of it.
So as we again begin to expand and add new content, risk anticipation and creating a culture of quality, safety, and value, while the microsystems analysis and the 5 Ps really continues to be a great framework for really doing a deep dive into understanding more about the systems, particularly at the point of care and beyond. We've expanded our content on the science of improvement because we're learning more about frameworks and models, as well as again focusing on the MFI and the Plan Do Study Act and expanding measurement for improvement. We've added some additional content on quality management tools and how that really works with students in projects, but also our academic, our clinical partners who are working with us in terms of improving care, reducing risk, and again anticipating risk, so that our culture of quality and safety and value added care can really be expanded. So a new chapter, chapter 16, on implementation leadership for sustainable improvement, really did a bit of history in terms of just the whole emerging field of implementation science and practice, and as well as dissemination practice and science, and how that really contributes to translational nursing. So we provided again some context in the way of the field, and again nursing is part of that emerging fields. And so our knowledge translation, the process at really getting there, and the leadership competencies for implementation, again specifically looking at from a project perspective, be it from a student project, and looking at what are the nuances around evidence-based practice uptake, but specifically around implementation science, which looks at fidelity, of the intervention and all the organizational nuances, and how one leads through implementation for sustainability and for scale up. Tricia, next slide.
So one of the things that we added to this textbook, and I think it's something that's getting more and more attention around the United States, is this idea of polarity thinking. So polarity thinking really is a way to recognize that many things in healthcare are really not problems to be solved, but platforms where two values that are equally important are creating a tension and really creating a space where neither of them is ever going to go away, and both of them are equally important for us to consider as we're making decisions. So when we talk about polarity thinking and wicked problems, it's really recognizing that there are many things in our lives that are not problems, and yet we talk about how to resolve issues in organizations as if they're problems to be solved. And yet what we know is that it really is a space where there are equally important values being expressed by groups or individuals that need attention, and that whether we address one or the other, they're both going to consistently be present. So when you think about it, it's things like we need both activity and rest. We need to be able to inhale and exhale. They're both equally important to the other, just as we need to have both direct communication and kindness and consideration. So those are actually examples of poles, and neither one is better or worse than the other. They coexist in the space and often create these things that we talk about that are wicked problems, or those things in healthcare that rear their ugly head, and then we think we have them resolved or solved in some way, and then they actually come back in full force. So there actually is a lot of work that's been done outside of healthcare, but in the government, certainly in areas of psychology, but in large corporate structures where people begin to think about and put on a lens around polarity, begin recognizing where competing values that are equally important one to the other, that coexist in the same space and time, are actually things that we need to manage. It's a tension that's created as we walk through a situation. And polarity really gives us the opportunity to consider both of them equally and to address and give attention equally to both. And by using a polarity map, you're actually able to come up with action steps that acknowledge both sides of the poles or both tensions, and to offer ways that you can move forward in a productive way to achieve what everyone can agree on is the greater common good or common goal. If you don't address them effectively, you actually experience more times than not the very opposite of the thing that you're trying to accomplish, and that would not be your greater good or your higher aspiration. And so we've actually put a chapter in the book that talks about polarity thinking and offers some ways as nurse leaders that we can use this kind of thinking to engage others in discussing those concerns or issues that seem to keep reappearing, that cause great frustration, or those areas that often people feel unheard in their practice. And rather than having them go silent or have them be out of our present view, this is a way for us to help people in really a safe space find language to dialogue around those things that often bring conflict. And in doing so, we open a new space, both for an appreciation of others, but equally a way to collaborate around common language and a common greater good or greater goal to accomplish the work that we all want, without negating those people who may have a different or opposing point of view. So this chapter actually walks through the principles of polarity thinking, ways that we can use polarity thinking and the evidence and studies on polarity to help us expand sort of our toolkit and repertoire to lead effectively and to build trust and resilience in our communities. But last but not least, I think the important piece is to offer the steps in a polarity process so that people can begin to think about how they would use this as they're walking through their organization and trying to contend with the pace and speed of change, and on the other hand, the need for us to be realistic and consistent in how we approach work so that others can join us. So I think it's an important contribution as we really begin to span many practice settings, but equally as we begin to engage with other disciplines that are not involved in healthcare landscape and to appreciate what they're bringing to this conversation in a way that can have the greatest impact and the most significant effectiveness in terms of outcomes.
And we expanded our chapter on population health and the quadruple aims, and really gave some really intense content on integrated care for population health, and looking at how technology has accelerated and transformed markets and the impact on the population and, again, care across the continuum, and incorporating not only triple aims, but the quadruple aims that really looks at our workforce, the environment, particularly when we think about the workforce changes, again, in terms of, caring for providers, that we know that millennials are used to immediate real-time communication, that healthcare environments or workplaces really have lagged behind in communication and often missing opportunities for greater engagement as projects unfold. So when we think about the social determinants of health, and how risk is stratified as models for population health, we incorporated a number of tools that are in place, for example, case management in an integrated healthcare system. So we have features that continue to be very positive from those of us who've used the textbook. So we've expanded the learning objectives. We have incorporated or continue to incorporate the American Organization of Nurse Executive Competencies and the Future of Nursing key messages. We have reflective questions that can be used in threaded discussions, as well as in-class instructions. We've expanded our case studies and exemplars, and we also updated the qualitative themes from nurse leaders. So as we began to look at patterns and trends, we looked at the external evidence, the research evidence, the literature, but also the qualitative, the voice of our nurse leaders and nurse executives and what they're facing. And so we believe we have the best of the internal and the external data that's really informed the changes and the updates that we've made. So I'll turn it over to Jen and Molly.
Thanks so much, Linda and Tricia. That was fantastic. I think the 8th edition definitely has some really, important points on management and leadership. And as we wrap up, I just want to remind everyone that if you do have a question, we are going to take any questions that you might have live. So you can just message myself, the organizer, in the question pane. Tricia and Linda have graciously provided their email addresses in case you have any questions that have come up and you want to reach out to them after the fact. You can also request a review copy by going to go.jblearning.com/leadership8. And if you would like to share the webinar, we will have that posted briefly or shortly online on our YouTube channel, and you will receive all of this information in a follow-up email. And I will just give it a couple of more minutes just in case we do have anyone with a question. But Linda or Tricia, I don't know if there's anything that you would like to say that might, wrap up the presentation. If we don't have any additional questions, anything more you might like to say about the teaching or how faculty are using this text in their classroom?
Yeah. Go ahead, Jen. I think what I would say is for many that have used this text in the past, they're going to find this to be a more streamlined version of work that we had in earlier versions. And I think the other piece that would call forward is we've taken it out of an acute care centric focus and really begun to look at community-based, non-acute care based principles of leading in nursing practice. And the other piece I think is different for many is that it isn't only about a chief nursing officer or a nursing director, but the recognition that executive nursing leadership spans many roles. And as we've gotten into new practice settings, we've also expanded into different executive leadership roles. Certainly we talk a bit about IT and health informatics, but the revolution in terms of data and big data management and really managing that spectrum as an element significant both to leadership and to practice is woven throughout the text. The other piece I think that we could confidently say is we've really begun to emphasize and call forward how nurse leaders emphasize the value of relationships, but really maximizing the potential of others. So first we do that with ourselves as we reframe and are coached into our own development by understanding ourselves and trusting our own inner wisdom. But we also do that by recognizing the gifts and skills of the talent, the people around us, irrespective of their formal title. And I think this edition of the book really has those themes woven throughout it. And I think it makes it a textbook that is ready for the times that we're now living in.
Also, I would add to that, thank you, Tricia, is that I've been really, very interested and pleased to see the many different ways the textbook has been used. And so it's been, again, very positively received by nurse faculty that have actually are teaching in nursing administration and nursing leadership programs, but also clinical nurse leader programs, programs that D&P programs that are focused on organizational and systems leadership, and using it to really, as Tricia said, to really look at the broader perspective. So while budgeting and managing human capital and performance evaluation are all incorporated in the text and continue to be standard. Again, this moving to care across the continuum, population health, implementation science, again, really adds to that whole growth in professional development of nurses, not only in the academic setting, but also from a clinical partnership perspective. So again, as we go to conferences and as we consult and individuals who, have used the book, shared with us, we continue to really appreciate, that voice, because again, it's essential to the work that we do in creating and developing the textbook. So thank you for letting us sort of put a point on it.
Oh, well, thank you both. I think that was a really fantastic wrap up that ties all of the content together. So thank you again, Linda and Tricia, and we'll be chatting with you soon. Have a great day, everyone.
Thank you.